So before we had a PERT and before we had, the AI integration, um, probably like in other centers, and maybe I'm exaggerating a little bit, it felt like it was a little bit chaotic. For example, people would come in, be diagnosed with pulmonary embolism. There'll be delays in the diagnosis, delays in the treatment, starting anticoagulation. And then if a patient was to get an advanced procedure, it will be kind of left to the whim of whoever's on call that day. And they would basically make a decision that seemed mostly like a unilateral decision. And some things occurred at our institution that may not have been optimal for the patient care. And we've had a couple really major significant side effects related to patients receiving advanced therapies that really they may not have needed, or they were not the appropriate therapy for the right patient at that time. And that really spurred on our want and our need to go ahead and develop the team and develop a whole new algorithm and how we approach these patients with pulmonary embolism. And I would see patients in the unit basically after they already would get some sort of therapy, whether it's a catheter placement or thrombectomy, and then they'll be like, "Hey, we did this for this patient. Can you monitor him in ICU afterwards?" And we really had like no input or no voice at all to say whether this was appropriate or not. And then if we want to integrate with other specialists, it was a much more difficult process. And then our thoracic surgeons may or may not be involved depending on, the time of day or the weekend, or for example. So it was kind of quite hectic in certain things. So we were lucky that we had this opportunity to develop.